Hi everyone, and welcome to my channel. I'm excited to share my content with you, and I hope you enjoy watching. Don't forget to like, comment, and subscribe to stay updated on my latest videos. Let's get started. In this video we are going to see about what you need to know about strokes. How do strokes happen? A stroke is an urgent medical matter. It occurs when a blockage occurs or, more frequently, when a blood artery in the brain breaks. Without treatment, brain cells quickly start to degenerate. Death or severe disability may result from this. Stroke signs: bodily numbness or weakness, particularly on one side. Vision modifications in one or both eyes, or swallowing issues. Unidentified headache with severe pain issues with balance, walking, or dizziness, confusion. Difficulty understanding or speaking to others. Run fast. The FAST test aids with symptom detection. It represents face sagging. Request a smile. Is one side sagging? Arm numbness or weakness. Every instant matters. Within minutes of being oxygen deprived, brain cells start to die. When brain tissue dies, the portions of the body it controls won't function properly. As a result, the leading cause of long-term disability is stroke. Brain damage can be stopped by clot-busting medications, but they must be administered quickly, often within 3 hours of the onset of symptoms. Tests might begin while you're still in the ambulance for the diagnosis. When you arrive at the emergency room, you'll have imaging tests like a CT scan, MRI, or ultrasound. You might undergo further tests, such as an EKG, which examines the electrical activity of your heart, and an EEG, which examines the electrical activity of your brain. Ischemic stroke is the most prevalent kind of stroke, accounting for about 9 out of 10 cases. When a blood clot prevents blood flow to or within the brain, an ischemic stroke occurs. The clot could originate there or move via the circulation from another part of the body. A major factor is clogged arteries. Thrombotic stroke. A weakened blood artery in the brain bursts in hemorrhagic strokes. As a result, there may be difficult to stop internal bleeding in the brain. High blood pressure is the most frequent cause. AVMs, arteriovenous malformations, which damage the blood vessels in the brain, and aneurysms are other causes. The mini-stroke, TIA. Another emergency is transient ischemia attacks, sometimes known as mini-strokes. When they occur, blood flow in a portion of the brain is momentarily impeded, leading to symptoms similar to a stroke. The symptoms end as the blood starts to flow once more. When one has a TIA or a stroke, it is impossible to tell. Thus, dial 911. A TIA is a warning indication as well, so consult your physician if you believe you have experienced one. Emergency medical care. In ischemic strokes, blood flow must be restored. A clot-busting drug called TPA is excellent at breaking up clots and reducing the possibility of long-term harm, but it must be administered promptly, often within 3 hours. Strokes that are hemorrhagic are more difficult to treat. In order to treat high blood pressure, hemorrhage, and brain edema, these conditions are often under control. Causes. Ischemic strokes are most commonly caused by clogged arteries. Less room remains for blood to circulate in the arteries as plaque consisting of fat, cholesterol, and other substances accumulates there. In this constricted area, a blood clot could form and result in an ischemic stroke. All that plaque facilitates the formation of clots and increases the risk of clot rupture, which stops blood flow. Hemorrhagic strokes. These can occur when an artery is ruptured by unchecked high blood pressure. Age is a risk factor for having a stroke, as is having TIA or stroke prior to developing heart problems, elevated blood pressure, diabetes, high cholesterol, and obesity. Additionally, increasing your chances include smoking, binge drinking, and not exercising. How are strokes recognized? A stroke will be identified by your emergency medical team based on a number of criteria, including your symptoms, medical history, physical examination, and diagnostic tests. The following heart and brain exams can aid in the diagnosis of a stroke. CORT scan for computed tomography X-rays are used in a brain CT scan to produce images of your brain. Magnetic resonance imaging, MRI, produces images of the brain using radio waves and magnets. Carotid angiography or carotid ultrasonography, these exhibit the interior of the arteries supplying the brain with blood. Echocardiogram, this test may be able to identify the origin of blood clots that have made their way from your heart to your brain by using sound waves to make images of your heart. To determine if your stroke is ischemic, caused by clotting, or hemorrhagic, caused by bleeding, which is crucial to treating your stroke, a brain CT scan or MRI may be performed. Blood tests can be used to detect a stroke, for example, by measuring how quickly your blood clots. What's for dinner? Plaque can make arteries more narrow if you consume too much fat and cholesterol. High blood pressure may result from eating too much salt. Consuming a lot of fish, whole grains, fruits, and vegetables may help reduce your risk of stroke. Taking less risk. To help you avoid having a stroke, find out whether you have any conditions that you need to cure. That might entail using medication as well as promoting healthy behaviors, such as eating well, exercising, and quitting smoking. Starting is never too late. What steps can you take to stop a stroke? Although having a family history of stroke increases your risk, there are numerous other risk factors that you may manage. Work with your doctor to lower your blood pressure if you have it. High blood pressure, which typically has no symptoms but is a significant risk factor for heart disease and stroke, is something that many individuals are unaware they have. It's crucial to control your high blood pressure if you want to prevent stroke. Quit smoking if you do. Learn how to control your diabetes if you have it. Diabetes typically has no symptoms, similar to high blood pressure, although it raises the risk of stroke. Start following a healthy diet and exercising frequently if you are overweight. Every second matters. The more time the brain goes without blood, the more damage is done. A medication that dissolves blood clots can be used to treat the most prevalent type of stroke, ischemic stroke. 3 hours are the window of opportunity for beginning stroke patient care. However, in order to be assessed and treated for a stroke, a patient must be at the hospital within 60 minutes of the event. How common are strokes? In the U.S., there are more than 795,000 stroke victims annually. According to the Centers for Disease Control and Prevention, 610,000 of these are strokes that occur for the first time, CDC. In the U.S., a stroke occurs every 40 seconds, and a stroke-related death occurs every 4 minutes on average. The sixth most common cause of mortality overall is stroke. Over half of stroke victims 65 and older will experience permanent mobility impairment. Although older adults are more at risk for stroke, around 1/3 of stroke patients who are hospitalized are under the age of 65. Prevention of stroke. Control your diabetes, eat healthily, reduce your blood pressure, exercise, and quit smoking. When I was 49 years old, I experienced a stroke. I have now had 67 years without experiencing another stroke. I didn't take care of my health in any way before to having my stroke. I smoked, was overweight, and had high blood pressure. When unfortunate events occur, individuals frequently wonder, why me? However, when I consider my stroke, I ask, why not me? I didn't take care of myself the way I do today despite having all the risk factors. My stroke taught me many valuable lessons, leading me to alter my eating patterns, give up smoking, and for the first time in my life, effectively manage my high blood pressure. I wish people knew they could avoid stroke. They don't have to experience it. That's all for today's video. Thank you for watching, and I hope you enjoyed it. If you did, don't forget to like and leave a comment below. Also, make sure to hit the subscribe button to stay updated on my latest videos. Until next time, take care.